Funding for Yale Cancer Answers is provided by Smilow Cancer Hospital. Welcome to Yale Cancer Answers with Dr. Anis Chagpar. Yale Cancer Answers features the latest information on cancer care by welcoming oncologists and specialists who are on the forefront of the battle to fight cancer. This week, it's a conversation about research into carcinogens in our drinking water with Dr. Vasilis Vasiliou. Dr. Vasiliou is Department Chair and Susan Dwight Bliss Professor of Epidemiology and Environmental Health Sciences at the Yale School of Medicine, where Dr. Chagpar is a professor of surgical oncology.
So maybe we can start off by you telling us a little bit more about yourself and what it is you do.
Okay, thank you very much. By training, I'm an environmental toxicologist, and we're looking for environmental-induced disease, which are conditions essentially caused or triggered by external factors. And these factors, it could include chemical or natural, as you said, water, biological, physical, and even psychological events that individuals are exposed to their surrounding waters. To the surroundings, One of the things that we have launched, we have been awarded by the National Institute of Environmental Health Sciences to have the Yale Superfund Center, which is focused on research of what we call emerging contaminants, emerging water contaminants, and those are chemicals of concern that they are not regulated by the federal or the state government, and it could be present in our water. Now, there are health implications of the presence of these chemicals in our water. And this is what we're studying. We're trying to find if they are indeed causing issues in human health and how we can really mitigate those chemicals from our drinking water.
So that is really concerning. I'm sure, everybody who is listening is very concerned about our drinking water. We tend to take it for granted that living in a first world nation, we have clean drinking water that certainly would not cause us harm. So the concept that there may be chemicals that may induce cancer in our drinking water is certainly concerning. So can you talk a little bit more about how you stumbled into this research and what you've found so far? Does the public have a need to be concerned, particularly when you say that these are not regulated by our state or federal governments?
Okay. Well, the one that we are studying is a chemical called 1,4-dioxane, which is used as a stabilizer of other solvents. The problem with this chemical is it cannot be filtered, and it also can be found in our household items such as detergents, shampoos, and so on. So eventually will end up into the water table and eventually can end up in our drinking water. That's the bad news. And the bad news also about this compound is what we called as possible human carcinogen, which means that there are studies in animals that they confirm that this is carcinogens. However, there are not epidemiological studies to confirm that this chemical causes cancer in humans. So this is what we're trying to get an answer about that. And so we're conducting studies in animal models to find the mechanism by which can cause cancer in the animals, so we can find ways to develop biomarkers for human exposures. And at the same time, especially with our center, we're trying to figure out if people are exposed to this. And the areas for the area of Connecticut, actually, were very good. We don't have that much of 1,4-dioxane in the drinking water. I would say almost nothing. However, there are areas in United States that there are considerable levels of 1,4-dioxane in the drinking water. Now, remember that this can be filtered only with expensive settings of what we called reverse osmosis, which is really, it's not affordable, especially when people have wells, and these systems cost between $6,000 and $10,000. So Long Island, for example, was in New York. This is an area that they had really high levels of 1.4 dioxin in their waters. However, with all the efforts, and this is why people should be feeling much better with the efforts of the state of New York, they have been put big reverse osmosis on municipal wells where the public water comes from. So we have seen that in the last couple of years, the water quality in the areas that used to be high levels of 1.4 dioxin is getting clean. So, but we still have other areas. For example, we have been contacted by Michigan, Ann Arbor, Florida, that they have areas that they still have really high levels of this chemical. Now, it's only the other thing I want to tell you is, in addition to 1.4 dioxin, there are some other chemicals that everybody knows, and you probably have heard. It's what we call the PFAS, the perfluorinated organic molecules that they're present. These are man-made chemicals that they're present. They're present in your Teflon cookware and or also on your clothing. And these PFAS exist for many, many years. And the problem with these chemicals are very persistent in our body. So once they get to our body, it can be really very difficult to be removed from our body. Actually, the monumental thing is, about 1 week ago, the EPA, the Environmental Protection Agency, really put the regulatory issues for 5-6 of these compounds. However, the problem is there are about 9,000 of these compounds, and this is a major issue. So in addition to 1.4 dioxin, you have the PFAS, which they just starting to be regulated. However, the PFAS, they're everywhere. They're everywhere. They are in Connecticut. They're throughout the United States, throughout the world, every piece. And this was because it was produced to generate clothes resistant, or cookwares and stuff like that.
So just a few questions to kind of go over some of the things that you've told us. So if these PFASs we know that they are carcinogenic, is that right?
Yeah, well, yes, we do.
And so if they're everywhere and they're very difficult to get out of your body, do you really think that in the short term there will be any impact in terms of regulation actually causing a reduction in cancer rates that are secondary to these PFAS molecules? Because, if I was exposed to PFASs using Teflon cookware, in my younger years, and it's very difficult to get out of the body, is the damage already done? I mean, is there any hope?
Well, there is plenty of hope, actually. Remember that our body is... it has a lot of mechanisms to bypass all these insults, the environmental insults. Even at the genetic level, you can have the repair of your DNA and so on. So what we're trying to do, of course, and it's not only cancer, especially with the PFAS, there are a number of other issues that it could be done. And it's not only on your Teflon cookware, it is also in the carpet, it is in the plastic that you put in the water and everything. It is... we know that it causes disease. There's a lot of research going on right now. However, the good news about the PFAS, they can be filtered much easier than the 1.4 dioxin. So there are now a lot of filtering that is going on, but we still have a lot of PFAS in the areas, and the one thing that I would advise is filtering the water, especially in the areas that they have higher level than what the maximum recommended level is to be there.
And with regards to the 1.4 dioxin, although the reverse osmosis equipment technology may be expensive, you mentioned $6,000 to $10,000, it seems to be a small price to pay if we know that that can eliminate a potential carcinogen. The question really is, do we know that it's a carcinogen? When you talk about, animal studies, have there been epidemiologic studies that look at areas that have high levels of 1.4 dioxane versus low levels to see whether there's a difference in cancer rates according to that, to give you at least a signal as to whether this is causing cancers?
Excellent question. So to answer the first question, no, there are not epidemiological studies. This is why the EPA and the International Agency for Research on Cancer, they call it as a probable human carcinogens. So our center is funded in order to identify the molecular mechanisms of causing cancer. The second is exactly what you're saying, to set up the basis of an epidemiological study that we can find people that they have been exposed to 1.4 dioxane. Then we can look at the history, we can look at the cancers, we can see if there is any association, or what we're looking for is if there is any causation relationship between the exposures and the cancer. So the other thing that our center is funded for, and as you said, $10,000 is a small price, but remember, there are individual houses. Now, for an individual house to just get a reverse osmosis for $10,000 might not be that easy. So what we're trying to do, and this is our engineers here from the School of the Engineering, is they're trying to develop small devices utilizing what we call the advanced oxidation processes, and those could be very cheap devices that they can purify individual tap water. And the other program that we have also with our engineers is to develop sensors that we can detect the 1.4 dioxane in the water.
Yeah, I mean, it seems like the other idea, which you mentioned as well, is not to put the burden of the cost on individual households, but rather to manage it at municipal or state levels where, for from the source, before that water gets from the well or the dam or whatever to your tap, that it goes through some reverse osmosis or filtering mechanism, so that the water that you get from the tap, you can be sure is safe. And so it really is wonderful to hear that New York did that. And I suppose the other study you can do, although I suspect it would take more time, is to look at those cancer rates before and after they implemented that technology. Is that something that is being looked at, and are other states thinking about doing the same?
Well, quite a few, not only for 1.4 dioxane, but also with, the PFAS, which is a much, much bigger and broader event throughout the country, and they use a lot of filtration. Now, I have to assure you, most of the public water, the dams and everything, they're very well controlled. And, they're watching them very well. The problem is when there is a big well, like in Long Island, the public water comes from these big wells. And as I said, the state of New York not only installed the reverse osmosis in all these sources of the municipal water, but they did something which is very good, and I think more states now are going to follow this legislation. So what the New York did is, as I told you before, 1.4 dioxane is either a component or it could be byproduct in a lot of our household items. So the state of New York banned all those household items that they do have 1.4 dioxane. So the manufacturers now are obliged to have 1.4 dioxane free or generating 1.4 dioxane free products. So by that way, you decrease the number of 1.4 dioxane that ends up in your water. And as I told you before, 1.4 dioxane could be a discharge of a manufacturing into the river or to a lake, but also it can come from our household items.
Yeah. Well, we are going to take a short break right now for a medical minute, but please stay tuned to learn more about cancer-causing carcinogens in our drinking water with my guest, Dr. Vasilis Vasiliou.
Support for Yale Cancer Answers comes from Smilow Cancer Hospital, where their prostate and urologic cancers program provides a multi-specialty team dedicated to managing the diagnosis, evaluation, and treatment of bladder cancer. SmiloCancerHospital.org. The American Cancer Society estimates that nearly 150,000 people in the U.S. will be diagnosed with colorectal cancer this year alone. When detected early, colorectal cancer is easily treated and highly curable, and men and women over the age of 45 should have regular colonoscopies to screen for the disease. Patients with colorectal cancer have more hope than ever before thanks to increased access to advanced therapies and specialized care. Clinical trials are currently underway at federally designated comprehensive cancer centers, such as Yale Cancer Center and at Smilow Cancer Hospital, to test innovative new treatments for colorectal cancer. Tumor gene analysis has helped improve management of colorectal cancer by identifying the patients most likely to benefit from chemotherapy and newer targeted agents, resulting in more patient-specific treatment. More information is available at yalecancercenter.org. You're listening to Connecticut Public Radio.
Welcome back to Yale Cancer Answers. This is Dr. Anees Chagpar, and I'm joined tonight by my guest, Dr. Vasilis Vasiliou. We're talking about cancer-causing carcinogens in our drinking water. And right before the break, Vasilis, you had mentioned that New York State is actually doing a few things that are quite innovative to try to reduce the burden of these carcinogens in our drinking water. One was to establish reverse osmosis kind of at the source, so that individual households don't need to worry about installing reverse osmosis machinery, because the water has already gone through that process. But the second that you mentioned was banning some of the chemicals that actually cause these. So you had mentioned earlier that these may be found in household items, detergents, shampoos, etc. So if we reduce the burden of these chemicals in these household items, then less of it gets into the wastewater, less of it gets into the rivers, less of it actually ends up getting back to us in the form of our tap water. The question that I have for you there is, it's great New York is doing this, but we have a global economy, certainly a national economy where, you can buy things in Connecticut and live in New York, or vice versa. So how effective is that going to be? And is this really something that should be a federal mandate, perhaps even a global mandate if we're going to get particular about it, in terms of really having an effect on reducing these chemicals in the environment?
That is a very good question, but I would say it's very difficult to address that, because when you start talking for economical impacts and stuff like that, it's very difficult to regulate for different countries and so on. But I think many states are trying to mimic what the New York State did, especially in the case of 1.4 dioxane. Also, many of the states, at least in the United States, and actually maybe in all over the world, they are very concerned about the PFAS. But there are some other also chemicals that might be present in our water that they could be of concern. And those are what we call the trichloromethanes, which are formed as a byproduct of chlorine we use for disinfection to disinfect the water. And when chlorine reacts with organic matter, it creates these trihalomethanes, which have been associated with increased risk of bladder cancer and possibly with colon cancer. In addition to that, remember that we also have arsenic contamination of the water. Now, arsenic, it could be an environmental pollutant, but also it occurs naturally in some areas, and it may contaminate the groundwater. So you put it very closely over there. That is very important to monitor our water. And I think all the big water sources are very important. Municipals are doing that. They're checking the quality of the drinking water. So they are protecting the people in there. Now, for the PFAS, now starts to become a federal law that they have to be limits on that. So they're going to follow on that particular limit as well. So reducing the exposures is one, detecting the exposures is the second, and also mitigating the contaminants from our drinking water is the three things that everybody is trying to do. And I think we're going to have a success. And this is how we're going to promote a better, a well-being.
Yeah. The question that I have is, for each of those three things, is the responsibility, does that rest primarily with the individual household or with the state or federal government? In other words, should I be in my home, testing my water, and should I be installing filters and or drinking filtered water? I mean, there's a whole issue about bottled water and the plastic contaminants that causes. Or is this really something that should be at the state or federal level or municipality level even, where the government will assure the quality of the water? They'll do the testing, they'll do the filtering, etc., so that I can know that the water that's coming out of my tap is safe to drink. And shouldn't that be part of what we all pay taxes for?
It is. And this is one, you're talking about the public water. So yes, municipal, state, and everything, they're responsible for checking the water, for cleaning the water, and they're doing a very good job to extent that they can. Now, the problem is with private wells. In private wells, as you know, they're not under federal regulations, they're not under state regulations. So it's up to the people that they have their private wells to check their water level. And for example, I can tell you some of the houses that we have here in Madison, they might have radon also in their drinking water, or uranium. It's naturally occurring thing. So it is up to the individuals that they have, the households that they have private wells to check their waters and then look for the filtering.
Yeah, so that at least makes me feel better in the sense that those who do get their drinking water from public sources, what you're telling me is essentially that if you get your water from a public source, you should be safe from these carcinogens. And that really the word to the wise is for people who get their water from private well water, that they need to take those extra steps to make sure that they're drinking clean and safe and healthy water. Is that right?
Yes, it is. Yes, you said it right, very correctly.
The other question that I have, you mentioned that the states are all doing a very good job in terms of detecting these carcinogens and purifying. Yet you mentioned that not all states have invested in things like reverse osmosis like New York has. And I would think, and this is just a guess, that the efforts that individual states may take in terms of the investment that they're going to make in terms of clean water may also be different, perhaps along political lines. So, is drinking water in a red state like Texas, for example, can we be assured that that water is just as safe as drinking water from a blue state like New York?
I think, what it comes down to, it's not, to my opinion, it's not blue or red state, is if there is a contamination. For example, in Florida, there was a factory which contaminating the sources, the water in the lake and everything. So what the federal regulation is, if you contaminate, you are responsible to clean the area. So the federal agency makes the company to pay for getting all the chemicals secured out of their environment and protecting the people. So I think it's the states are trying to do, especially the EPA is trying to force all these rules. and is doing a very good job in terms of that. Now, you're going to have cases that you have a little bit more contamination there, that it's up to the municipalities and everything to follow up. And I can assure you, with my experience, especially with Florida and Ann Arbor, there are people working both from the communities, also with the EPA, the Environmental Protection Agency, and also the state regulators to have safe drinking water.
Yeah. It would seem to me, however, that, particularly with the ubiquity of these chemicals, right? They're in shampoo, they're in Teflon, they're in detergents, they're in carpet, they're in clothing. It's going to be very difficult to identify particular companies that you can say, you're responsible for contaminating this water, therefore you need to pay to clean this up. It seems like it's kind of a ubiquitous fait accompli. And so...
Yes and no. Let me interrupt you for that. And I'm going to, if you look at all the literature lately, or if the news, the 3M and DuPont paying big dollars to purify the waters from the PFAS all over the country. And also in Florida, for example, the companies were, once you find the company that has caused the contamination, then they're responsible to clean it up. So yes, it does occur.
Yeah. You would hope that that would be enough of a deterrent for companies to do their own self-regulation and reduce the quantity of these chemicals that they're producing. Although it seems like New York felt that a ban was actually needed as well.
Yes, indeed.
Now, you had mentioned during the break that some of these ideas were particularly relevant for firefighters. Can you tell us a little bit more about that?
Yes. Well, the firefighters, our firefighters are exposed to several chemicals, including polycyclic aromatic hydrocarbons, benzene, formaldehyde, asbestos, chloroform, vinyl chloride, but most importantly also, they're using this what we call the AFFF, which is known as the aqueous film forming foams. This is the one that they try to put the fire down, and this is all PFAS. So, and the studies have shown so far that the firefighters have significantly elevated PFAS in their blood compared to the other populations. Now, we all have PFAS in our blood because we're all exposed to the PFAS. That doesn't mean that we're going to get sick, but the firefighters have a little bit higher levels, and this is a concern. However, there is no epidemiological study yet, although we say it may increase the risk of cancer for these people, but there are not epidemiological studies to confirm that. So everything is on the risk idea. Mm-hmm. And for the firefighters, what it's very important is to have this protective gear that they will breathe clean air and they be protected from the exposure to these chemicals.
Dr. Vasilis Vasiliou is Department Chair and Susan Dwight Bliss Professor of Epidemiology and Environmental Health Sciences at the Yale School of Medicine. If you have questions, the address is canceranswers@yale.edu, and past editions of the program are available in audio and written form at yalecancercenter.org. We hope you'll join us next time to learn more about the fight against cancer. Funding for Yale Cancer Answers is provided by Smilow Cancer Hospital.